Elsewhere tonight, new health concerns over testosterone drugs designed to boost energy, libido, and muscle mass in men.
Testosterone drugs are a $1.6 billion business, but dozens of lawsuits now allege there can be dangerous side effects. CBS 2 investigator Pam Zeckman is here with more on what men need to know about these testosterone drugs. Pam.
Rob and Kate, they need to know that recent studies have found there may be an increased risk of a heart attack, stroke, or other cardiovascular disease for men taking testosterone.
I have low testosterone. There, I said it.
This Androgel commercial and website encourage men to try testosterone replacement drugs.
And I thought, well, it might be something good for me. So I decided, hey, why not? Give it a shot.
But after about 2 years of using Androgel, Downs had a stroke, which he blames on the drug.
I was in a lot of pain, dizziness, confusion.
He's still struggling to recover and now plans to sue.
So we believe there's an egregious failure to warn in the package insert, in the television advertising, and had Mr. Downs known of the risk of heart attack and stroke, he never would have taken this product.
Androgel defends its product, saying it has more than 10 years of clinical safety data, and the known therapeutic risks are well documented in prescribing labels and here on its website, which mentions blood clots and hypertension as side effects. Now, a consumer advocacy group is asking the FDA to require that all testosterone drugs have stronger warnings on their packaging about cardiovascular dangers.
The FDA, as of now, is reckless in not warning doctors and patients in this country of the increased risk of heart attacks when using testosterone.
Dr. Wolf cited recent studies that have found that Androgel and other testosterone products doubled the risk of heart attack in men over 65 and in younger men with a history of heart disease, possibly due to increased production of red blood cells.
The jury is still out on the studies that have been done on testosterone.
Dr. Paul Savage, who prescribes testosterone in his practice, says the key is proper patient evaluation and monitoring of testosterone levels.
And for the men who qualify, giving them testosterone has had remarkable changes in their life.
But Sidney Wolf says many men taking testosterone have never even been tested to see if they need it. What concerns you about the hype?
It's recruiting all sorts of men who really shouldn't be taking testosterone to taking a drug that can increase their risk of heart attack.
Besides Androgel, there are at least 8 other products named in lawsuits. The FDA has now issued a statement about testosterone drugs, saying it's going to investigate the cardiovascular risks, but it has not recommended that people stop using the products. You can see the full Androgel statement on our website. Rob and Kate, the key here is that these drugs do have to be prescribed by a doctor, and it's very important to get that blood test that's going to tell you whether you really do have a low testosterone level before you take them.
Because some of the symptoms could be that of just getting a little bit older.
That's right, and you don't want to take them if you're getting a little bit older and you have a history of heart disease or you have any other medical conditions that would make this really dangerous.
Good advice. All right.
Thank you,
Thanks.
Pam.